how this bill is constitutional based on the religious exemption it gives essentially to one insurance provider that creates for them a significant financial advantage over their competitors.
One moment, Mr. President. Mr. President, to the second portion of the question. The question is, does this provide a market advantage to insurers? To be honest, I believe if it did, we wouldn't have the situation we have. I don't know of any insurance company regulated by DCPS that is opposed to this bill. In fact, some of them have endorsed the measure. I suspect this would not be the case if insurers felt significantly disadvantaged their companies relative to any exempt insurers. Also, there is nothing in this bill that prevents DCPS from intervening if they determine an insurer has an unfair market advantage as a result of this or any other legislation. Mr. Chairman, I would ask if the questioner wanted to give a follow-up, because I was going to talk for a fairly extensive period of time about the exemptions under this bill.
I would let him do that in his close.
Excuse me, are you asking for a further question?
I am not.
Okay, because I don't think he's closing. I think someone else is closing, but you want it covered?
Well, that may be.
Do you want it in the closing, is what you're asking?
Preferably, yes.
Well, to those who are going to close, I guess to the extent you want to cover it. You know what? Just don't do that. Do you have further to say to answer that question or not, Senator? Because I don't want to be in a situation where something Senator Knope wants was not explained on the record. So I'm trying to find out the way to deal with this between closing and more information. So Senator Knope, I'm going to ask the Senator Devlin if he would talk further on your question. Is that all right?
That's fine. Are you going to yield me more time? You can yield me time.
We'll get you the more time. Okay.
Thank you.
Yeah, go ahead. Go ahead.
Thank you, Mr. President. To the questions. There are 3 exemptions within this bill. For insurers, in Section 27E of this bill states that insurers are not required to cover abortion if the insurer offering the health benefit plan excluded coverage for abortion in any and all of its individual small employer and large employer group plans during the 2017 plan year. Secondarily, for religious employers, there is another exemption, the second exemption for religious employers. This exemption allows an insurer to offer a religious employer a health benefit plan that does not include coverage for contraceptives or abortion services that are contrary to the employer's religious beliefs. Also, I think this should be understood in terms of the statutory definition of a religious employer under ORS 743A.066. A religious employer purpose is the inculcation of religious values that primarily employs persons who share the religious tenets of the employer, that primarily serve persons who share the religious tenets of the employer, and that is registered nonprofit organization. Finally, the last provision relates to the DCPS to grant an exemption to the bill's requirements for abortion coverage if enforcement may adversely affect the allocation of federal funds. That citation is on Section 2, page 4, lines 10 through 12 of the bill. The Weldon Amendment, which has been referred to in committee, passed as part of the Health and Human Services appropriation and has been readopted or incorporated by reference in each subsequent Federal Health and Human Services Appropriation Act since 2005. It provides that none of the funds made available in this act making appropriations for the Departments of Labor, Health and Human Services, and Education may be made available to a federal agency or program or to a state or a local government if such agency, program, or government subjects any institution or individual healthcare entity to discrimination on the basis that the healthcare entity does not provide, pay for, provide coverage or refer the abortions. It also defines healthcare entity to include an individual physician or other healthcare professional, a hospital, a provider-sponsored organization, a health maintenance organization, a health insurance plan, or any other kind of healthcare facility. Fundamentally, in those particular cases, this bill gives DCBS the ability in that third case to grant an exemption.
To the bill.